Hello and welcome. We have been talking about using Bluetooth versus GPS or some combination of both for contact tracing or exposure notification here at SafePaths for a couple months now. And this last week, our attention has focused a lot on the new Google-Apple policy. So to get us all on the same page as we begin this afternoon, I wanted to read from an article by Darrel Etherington over at TechCrunch that outlines the new policy and specifically the part about location data. So Darrel writes, they, meaning the developers, can't access or even seek permission to access a device's location services, which provides specific geolocation data. Google and Apple note that apps already available from public health authorities that make use of location data will continue to be offered, but that no apps that make use of the info will also have access to the new exposure notification API. So we're going to talk about this afternoon, and we have Professor Ramesh Raskar here to share how we're thinking about this at SafePaths. And then we have a wonderful guest this afternoon. We have Ryan Naughton from the COVID Alliance, and he'll share his opinion and what he's working on with us as well. We also have a couple of our talented team members back today. We have Deepti, who will be introducing a new segment focused on the amazing community that we are building here at SafePaths and how we are engaging with them. And we have Sienna back, who will give us an update on the rollout of SafePaths. So I'm very excited to be able to introduce all these talented people to you this afternoon. My name is Rachel Barbar, and I'm a volunteer with the communications team here at SafePaths. You can also connect with us on social media. That's another great way for us all to get to know each other better. So now to dive into this conversation around Bluetooth and GPS, we have Professor Ramesh Raskar from the MIT Media Lab and founder of the SafePaths initiative. Good afternoon, Ramesh.
Thank you. Hello, everyone. This is Ramesh Raskar at MIT Media Lab, leading the SafePaths initiative. So wonderful to be here. And let's talk about contact tracing for public health as well as for reopening businesses in a privacy-aware manner. SafePaths' primary mission is to create public health solutions that can be used for countries or states and for big employers. So we are here as a large open source effort to help countries deploy privacy-first public health solutions and help big employers to start their businesses using our solutions. And in that sense, we have three main segments. We want to help citizens with a mobile app, self-assessment, and information. But our primary effort right now is to help governments, which is states and nations, create their own apps using the fantastic open source code base we already have. Also create backend dashboards that I'll talk about, create interoperable backbones. So as individuals pass between different states and different nations, they're still working and providing training and monitoring material. And then for big employers, we are creating back to work solutions, including dashboards that do not interfere with the personal freedom of the workers or the employees. And we're also bringing together solution providers who can work with these big employers and also build a relationship with these corporations. So in simple words, digital contact tracing is about using the smartphone technology such as GPS and Bluetooth for computing proximity, and then creating notification if you're cross path and providing context. And number three, maybe the most important, is to provide public health and large employers coordination tools that still maintain privacy of their citizens or employees. And we want to achieve that while maintaining privacy. And by privacy we mean five things: the consent, overcoming any regulations, especially for health data, overcoming challenges of data silos because the insurance players, the public health, the government, and hospitals may not be able to talk to each other. Also making sure national security is taken into consideration because social graph of a country is kind of a national treasure. and also what's the incentive for somebody who's healthy and young to participate in a system that will benefit the rest of the society. So as I said, on one hand, we have the flagship app, the SafePaths app, that does the things that you would expect, like exposure notification and very soon symptom tracking and quarantine verification. And on the right, we have the dashboards for public health and large businesses that can expedite any human conversations, like tracing conversations. And very soon you'll see hotspots and spread prediction, coordination with at-home population. And then SafePass is building a privacy-preserving algorithms and software principles that we use various proximity technologies, including the Apple and Google APIs. And SafePass really has three pillars: the technology, as I described, the mobile app, the dashboard, the open source, the world's largest open source code base for contact tracing, as far as I know. Some really great algorithms. We are writing papers almost every week, an interoperable backbone, the think tank that talks about privacy and ethics and brings stakeholders together, and we write papers about the landscape. A great paper has come out just last week. You should take a look. And then implementation side, having kind of last mile engagements with public health and training and monitoring and bringing solution providers on a common platform. So we have a fantastic alliance that made up of MIT faculty members, as well as is being shaped by some wonderful mentors from WHO and HHS and CDC and Mayo Clinic and so on, as well as our nonprofit foundation that's part of SafePaths Alliance called PathCheck that's working with some wonderful partners to bring the last mile solutions. So we want to use SafePaths for many stakeholders, governments, workers, labs that are doing the testing, healthcare, insurance, schools, and so on, so that workers can get, for example, sick leave approved, or schools can scan students at the entrances, but also monitor any COVID positive students who might be staying in dorms. Or globally, for employers, how do you clear employees, provide management for them, provide incentives for them to get back to work with minimal liabilities and so on. And of course, this would all have been easy to deploy as a software solution, but how do we do this in a privacy preserving way? And that's where some amazing algorithms, some amazing technology, and very robust code base comes into picture. So for an individual, the experience flow might be exposure notification, followed by contact tracing, followed by testing, followed by telehealth, followed by quarantine verification, and closing the loop with public health. So you'll see solutions from SafePaths that come across the whole life cycle of an individual in case of their COVID experience. At the same time, creating kind of this early rejects using very automated tools on smartphones. So it's not just about exposure notification or contact tracing, but the whole workflow. And for big employers, how they work with their employees and workers, the workflow, of course, looks very different. And so SafePaths is exploring with our partners and some of it on our own of what does it mean to provide end-to-end solutions for big employers, all the way from exposure notification on contact tracing, of course, but what happens at the entrances, how do you improve interactions, how do you do scheduling, what do you do when cases, you have false negatives, false positives, and individuals do end up impacting other workers and so on. Incentive models are very critical here. And because SafePaths truly believes in collaboration, we are not here to pitch one app or one technology or one particular solution. We are here to collaborate and not compete. And that's why it's an open source platform where we continue to create all kinds of tools, and we're agnostic to proximity technologies. At the same time, many solution providers are coming to us with identity solutions or open ledger solutions or thermal IR cameras that can provide social distancing measures or temperature sensors at entrances for monitoring, new types of telemedicine, telehealth platforms, and so on. And so we're bringing a lot of the solution providers on a common platform. So if you're one of the solution providers, please send a one-page summary on our website. And there's a rolling deadline every Tuesday at 5 p.m. If you're a solution seeker, typically a large company, a large employer, then we want you to pose your challenges. And we're already working with some Fortune 500 partners, and pose your challenge and tell us if you're willing to do a pilot or contribute your expertise. So it's just a wonderful platform. So check out our website, covidsafepaths.org. And if you're a public health or a big business and thinking about what IT solution should you use for COVID software solutions, then we believe it should be privacy first. It should be open source, so you don't have a vendor lock and you're locked for many years into their system. It should be interoperable, support multiple languages, and should really support non-smartphone users as well. And we think that SafePaths is providing the abilities to reach people even if they don't have a smartphone. Ecosystem for public health, so it doesn't displace what the public health is already doing, because at SafePaths we believe that software on its own is not going to solve this problem. As much as we love technology, software on its own is not going to solve the problem. And we have to realize that coordination between software and public health infrastructure, it's what's really going to allow us to overcome this challenge. And in that sense, we want to provide solutions for public health and large employers in terms of dashboards for hotspots and spread analysis that are still privacy preserving, which means they do not release any personally identifiable information of an individual. And there are some really nice papers that have come out from our think tank team, landscape analysis, as well as the apps gone rogue document that's being recommended by CDC. So CDC has recommended 2 documents, both of them from MIT. One of them, the apps gone rogue from SafePaths, and another one from MIT PACT, which is the Bluetooth protocol. So let's talk very briefly about the Google Apple exposure notification proximity API, where an infected person can upload the keys that they have shared over the Bluetooth channel into the servers, and then all the healthy users can download those keys to see whether the Bluetooth keys are the same as the downloaded keys, and that closed loop would tell them if they came in close proximity of an infected individual. So this is fantastic. As you know, Bluetooth has many benefits. Nevertheless, we think that if you don't have location context in contact tracing, it can lead to a lot of problems. If the only information you received was you're exposed on a Tuesday, but not when, not where, it can possibly lead to low trust in the system. It can lead to false positives and negatives. If you got the alert that you're exposed on Tuesday, but you went to the grocery store, and when you went to the grocery store, you're wearing a mask and you're not shaking hands and you're keeping social distance, what does it mean to even get that exposure alert? So the lack of agency and confusion can lead to some irrational behavior, maybe risky behavior. And it also doesn't help the public health to interview the person who may have been exposed, create heat maps of where the spread is, and so on. So we think the exposure notification on its own does not solve the problem, because without context, you could imagine certain underprivileged populations, especially minorities, could get blamed for those exposures, and overzealous enforcement can lead to all kinds of challenges. And we are already seeing in many parts of the world, it's causing a lot of civic unrest and civic challenges. So we think that exposure notification is a good start, but doesn't solve the problem for public health. So in our think tank, we have published a series of papers now on how we can add encryption that combines Bluetooth and GPS. And one of the short-term approaches to be consistent with the Google Apple API is use Bluetooth for proximity only. We call it Google Apple exposure notifications, so GAIN, and use GPS not for proximity detection, but only for memory jogging and for context. And we have provided 2 solutions. One is continue to use GPS in a low resolution mode, which is blurred mode, or option 2 is transmit GPS coordinates to the exposed person over an encrypted Bluetooth channel, so that only the exposed person gets to know the location, but nobody else in the world, not the infected person, not the government, not the app developer, gets to know the location context of what happened. And we think these are reasonably good solutions that maintain privacy and can handle false positives and negatives, but probably most important, it will help the public health. So our expectation is that the next few versions of the Google Apple APIs will be influenced by proposals of this kind, and we can talk more about that in the Q&A session. So to conclude, SafePaths is really here to create solutions for citizens, but our emphasis right now is to help countries and states build their own apps. So we're not here to compete, and we're here to help them create their own apps based on the large open source code base we have. We have a fantastic engineering team at SafePaths, and that's working with many jurisdictions every day. I know there was a call even at midnight or 1 o'clock yesterday night because we're in different time zones, and helping them with an interoperable backbone and providing training and monitoring. So this middle column is really the biggest focus for SafePaths right now, to help countries and states launch their own solutions based on our code base, based on our material. And we're also working with big employers about back to work solutions for them and dashboards. So really, to overcome this crisis, we need choreography by government and businesses. But if we let that happen in a traditional way, it will lead to a big brother situation or a surveillance state. So SafePaths is really creating privacy aware tools that on one hand solve privacy, and on the other level also solve the interoperability. So those are the two main things we want to achieve: privacy and interoperability, so that communities can coordinate amongst themselves to overcome this public health challenge, help restart the economy, and over time build resilient societies. Thank you.
Thank you, Ramesh. Now let's bring Ryan into the conversation. Ryan Naughton from the COVID Alliance is here. He is the founder and co-executive officer at COVID Alliance. And welcome, Ryan. I'm hoping you'll tell us a little more about yourself, about the COVID Alliance, and some of the things that you are thinking of and working on there.
Absolutely. Thank you so much for having me. Let me kind of give a background of the COVID Alliance first. So we're a non-for-profit organization and connecting governments, public health organizations, healthcare providers with best-in-class experts across science, policy, and technology. And your sort of tagline of we're here to collaborate, not compete, really resonates with us, because the Alliance, the name itself is quite important. We're trying to bring together different partners and enabling those partners to help provide services to one another. I often use this tagline: to conquer an exponential disease requires unleashing the exponential power of human collaboration. So with that in mind, we have sort of two key areas of focus within our organization. One is situational awareness or decision support tools. These are for public health departments, for governments, for sort of aiding in the community response. And that underpinning that is a secure data platform, differential privacy layers, all these access controls we can talk further about. And then the sort of second area of focus that I think is more pertinent to today's conversation is the COVID aid network. And the goal here is we're creating a platform and an open technology standard for states, municipalities, and healthcare systems to coordinate providing services to individuals in their community who need them. And this includes verification of the person's sort of situation. This is where exposure notifications need to be credible and are very important, and then allows people to get access, depending upon their personal situation, to social support and medical support services. So we have partners for deploying mobile labs to hotspots, partners for sending testing to high-risk individual or immunocompromised individuals' homes. We have social support services like housing services, displacement services, meal delivery services. All of these we could see is critical to the ecosystem to providing a solution here. And all of them are very dependent upon our trust that the actual exposure is a trustworthy exposure.
Absolutely. I think, one of the really interesting things, both from what you're doing and how we've started really thinking about and working on things here at SafePaths, is that, while we all like tech and we have a lot of tech people, there is so much more to this than just a single tool. And I know you're working really hard to build that ecosystem, that it goes beyond just one thing.
Yeah, absolutely. And I think that's also why I think something I really appreciate about your organization's approach and why we're so excited to work with you is that we need to have sort of an inclusive approach with transparency about methodologies, transparencies around standard setting, so that it actually builds trust and more groups want to continue to come in. And I think sort of unilateral standard setting is not going to be the solution for that. And I think that's really how we've gotten a lot of groups excited. They can see how they can plug in because they see not only is there an opportunity for them to grow sort of their organization in a meaningful way that impacts this, but they see that there's sort of this force multiplier to one another. So we're not an island. We all have to work together.
Excellent.
Absolutely. And Ramesh and Ryan, I'm wondering, as you're talking about standard setting, what your thoughts are and what kind of steps you're thinking about towards that goal.
So I think the main question here to address is that, you know, we cannot be living on an island, as Ryan said, and especially when we have very large tech companies like Apple and Google, also with very good intentions, trying to help us help the community. We work very closely with Apple and Google, and they have been extremely helpful in kind of having conversations about what we think, what they think, giving us a preview of what could be coming next, and so on. Is that we truly have to think about these open standards. And the question about interoperability is one of the biggest one. And you will hear very soon from SafePaths, you know, some really great solutions that will allow us to work across these different technologies. Exposure notification is only a small, important, but a small piece of it. But as we talk about contact tracing, as we talk about public health solution, as we talk about quarantine and so on, we are creating a backbone of interoperable solutions.
Yeah, absolutely. And I think just to piggyback on that, recognizing that in many ways, Google and Apple are in a pretty hard place. So I don't think we should put any sort of blame them. They want to solve this problem, but they recognize that the average consumer is not necessarily going to be extremely educated on the nuances of this technology. And they want to make sure that they're being perceived as maximally privacy preserving. I think the path forward I want to figure out is how do we ensure that the conversations that are being had result in widespread adoption of a single standard in a way that actually the standard isn't just one standard, but the standard actually has the input of all the public health department officials so that it actually can solve the real problem. And I think one area I'd like to maybe talk about and focus on is the interaction between the technology solutions and the actual manual contact tracers. I think with the reality that we need to scale up manual contact tracing, and we need to have it be a solution where the public health department can very easily do an evaluation of that exposure. Lowering any cost of doing so is going to be of paramount importance. And so I think multiple layer solutions that each one of them has fills a different gap is essential, because there are just too many gaps to fill. I think as Ramesh has talked about in previous videos, the square problem of this, if you just use Bluetooth, means there's just going to be a massive gap there. So it has a role to fill in some areas, but even with people not using, let's say, GPS or Bluetooth, we still have to have a way for people to do old school manual contact tracing. So the layering of all three is essential. And if we don't recognize that reality and they're siloed from each other, we're not going to be able to solve this.
Excellent.
Absolutely. And Ryan, I know one thing that's been interesting for me is a little bit how you even started with COVID Alliance and where this thought came from for you, and what inspired you and led you to jump into this.
Sure, absolutely. So I guess if we kind of go back in time, even beyond the 7 weeks ago when this gestated and became a reality, my wife and I both studied economics and public policy together. And she continued in that track and has been at the Rand Corporation and the World Bank and places like that. I switched over to the technology side of the world and been at Silicon Valley style tech companies. And we've had this long running debate. It's our dinner time conversation of what side of the house is going to solve the problems of the world first. We know we're introducing problems with technology, but we need scalable solutions to solve them. And so we realized, as that's often our dinner table conversation as well, that we have a really great network intersecting these two worlds. And this is where, deep passions in our life lie. And so that's part of the reason we have 7 folks from the Rand Corporation providing public policy work. Our head of public policy is a Rand Corporation researcher, as well as I pulled in my network of technologists. And I think that kind of goes to that you can't just, a tech-only solution is not going to solve this. So I think, had to bring together multiple different groups. Within about a 24-hour window of realizing that we wanted to activate, we had a core team that had, former Clinton administration folks who were really great on the government affairs side, former McKinsey consultant who, is leading our strategy efforts, the former chief science officer from the ONC, who really led the standards and interoperability framework and his goal, I think, which aligns well with yours, is the nature of interoperability. How do we create standards that allow us to scale well? And also sort of between his expertise and others we have, how do we scale armies of volunteers? I think that kind of goes to that exponential collaboration. And so pulling in the right resources. So currently we're at about 170 total individuals who are volunteering. A core group of probably 20 or 30 of us are doing 90-ish hour weeks. The next 30 to 40 are doing probably full-time, and it kind of tails off in different degrees there. And it's just been really rewarding to sort of pull together all these groups.
Yes, it's amazing. I know one of my favorite things about being involved with the SafePaths initiative is that it really is this volunteer group of people who have come together, and such talented people giving their time. And you really have the same thing happening at COVID Alliance. You have amazing people who are really giving to try and solve these problems.
Yeah, and I think one of our goals as well is not only do we want to solve the obvious pressing problem of the pandemic in front of us, but we see this almost as a catalyzing event for like new mechanisms of public-private partnership, new mechanisms of sort of creating frameworks in which people, and that's, I think, one of the big projects we're working on is how can people get better access to social services, right? There's so many cases where people have a right to a social service, but they're not aware of it, they don't know about it. I think this moment is sort of catalyzing the reality that we need to be better about this, because even just looking at how California, took a large chunk of their homeless population and put them in the Motel 6s, we should be doing smarter cost-benefit analysis. It's better to do that than to pay the cost of hospitalization. Well, is that not similarly true for other aspects of housing policy? How do we not do these as one-offs? How do we create frameworks for collaboration that allow us to bring to bear sort of some of the world's best technologists and researchers and universities, so they're not sort of siloed in their separate worlds, but create a new way to sort of build these solutions?
Well, you're certainly speaking to my heart right now, because, I watched patients, particularly with disabilities, who have needs across the spectrum, and trying to connect to all those social services. And it's a problem that goes far beyond just the pandemic and COVID. Ramesh and Ryan, I want to give you a chance to bring up anything else that you think we should be talking about and focusing on this afternoon here before we move on to our next section.
Yeah, I think one question that keeps coming, and Wall Street Journal just wrote a very nice article about our work by Joanna Sturm, and I think she captured the spirit of SafePaths very well, which is we are here to provide technology and framework and interoperability to anybody to solve the public health problem. We don't have a specific dogma or religion about exactly how we want to achieve it, as long as it's privacy preserving, and as long as it's ethical, and as long as it's inclusive. And in that sense, the question we get all the time, are you a GPS-based solution? Are you a Bluetooth-based solution? Are you a Voodoo-based solution? We are all of those things. And so we already have the GPS-based solution out there that's being piloted in this beta version. And we also have coming up a purely Bluetooth-based version based on the Apple and Google protocol. And that can only be what Apple and Google allows in version 1. And so you'll have that available in the next few days, and we're already working with many jurisdictions to help them bring it out. So if you are a state or a nation or a big employer who wants a pure Bluetooth-based solution based on Apple Google API, SafePaths is your partner in that sense as well. But we think over time those two solutions will merge, and we'll have just one global solution that's still privacy preserving. So just to repeat, version 1, we already have GPS solution out. Version 2, you will see a Bluetooth only solution using Google Apple API. And we think version 3 will be some kind of a merger as the whole ecosystem emerges from it.
Yeah, and I think to add on something that's core of our philosophy that I know is also core of yours is individual control of their data. Right? And I think sort of with the mobile application that we're working on as it relates to these social services and medical support services is that the individual should be able to choose when and how they want to share that data. And so a data minimalization framework there as well, where the data can stay local to the phone. And if you want to prematurely share all of your contacts to the cloud because you want that to help inform the probabilistic priors for the models that people can do that, you can do so. But if you instead want to be maximally privacy preserving, put that in the power of the individual. In the same way as with symptom monitoring, if we have a partner where you can log into your patient portal on the app, it pulls your electronic medical records, but only to the device. But now, if you want to share those to the cloud, you could do so. So in a situation you might want to is, your health situation is deteriorating, you need access to increased access of care, you want that communication channel, you want to share your symptoms. But other people might say, I want to share them earlier because I want them to know how me as a COVID positive patient are doing so they don't have to worry about me, right? And I think that kind of like empowerment to individuals, I think is going to be part of this building trust. And I think that just something you said, Ramesh, that kind of triggered a thought in me is the other side, I think, is we want to ensure that we're coalescing these efforts together. So we don't want to duplicate efforts that you guys are doing. We want to collaborate, and we want to figure out where we can deduplicate so that our resources can go further. Right? And so I think in that mindset, and I know we're working on some conference with you guys wherein we want to bring together all these best-based efforts. We want to make sure that we don't have this duplication and we can actually repurpose resources to the best outcomes. And we're really looking forward to sort of bringing all those groups together and hoping that can build more consensus around sort of common standards.
Yeah, I totally appreciate that thought, Ryan. And I think this has been the mission for SafePaths from day one. Even when we're sitting in a small conference room at the MIT Media Lab and just thinking about what should we do in this space. And we had some initial ideas. Of course, my research, my group's research at MIT is also about privacy preserving machine learning for health. And we're just thinking about what we should do. And what has been amazing of how many different organizations have come, either they have merged with us or have joined forces with us to continue to do that. And over the next few weeks, you will hear from more and more of them because we believe that SafePaths is really here to collaborate. And not to push one particular solution, but to create a suite of solutions in addition to the flagship solution that we have. All right, Rachel, should we move on to the questions?
All right. Well, thank you both. This is so interesting, and I hope that everybody listening will keep an eye on us here at COVID SafePaths, but also at the COVID Alliance, and stay connected with us. So now we are going to move on to our first news section, and we have Deepti, our SafePaths brand specialist, who is here to introduce the community forum. Good afternoon, Deepti.
Hi, Rachel. Thank you so much. And thank you, Ramesh and Ryan, for the deeper insights into COVID Alliance collaboration with SafePaths and highlighting that technology without social engagement in a vacuum is not going to help us solve these problems. And I would like to take this thread forward and also draw attention to the meaning of such collaborations within our SafePaths community of more than 1,200 people and growing. So let me start with a personal story right now. I'm working here in communications in SafePaths, and by the nature of this work, I am blessed to have interactions and cross collaborations with different teams and people within this community. There is expertise from diverse professional backgrounds, diverse partners, as you just saw, which leads to a unique cross-industry intelligence-driven ecosystem that is truly global. So with reference to my story, last week, I had 2 such interactions that made me sit up and wonder what a rare collaboration I'm part of. The first interaction was with one of the colleagues I work with often remotely in terms of our website and blog management. And this person is living in another part of the world, and I don't remember what that was, but I could sense brilliant mind behind our interactions, and something triggered this conversation. When I asked him, "So, how old are you?" The answer I got sort of baffled me. It was someone half my age, just starting out his career. We call them Gen Z. The very next day, I was scheduled for an interview with Kyle working on our tech team, where I wanted to get his views on his interactions with health authorities and what their real needs are. And now this immense wealth of knowledge that came my way was an interaction that is from someone who is retired with his last 14 years spent at PayPal. And here I was, listening to the stories and contributions of 2 generations. And by the way, I often refer to myself as a millennial, someone in the middle of the 2 generations, with some experience behind me and some more to come. I come from a design and branding environment where we often talk strategies to appeal to a Gen Z or a Gen Y or a Gen X, but SafePaths did not have to appeal to anyone. What brought us together? What binds us together? It was not a piece of targeted marketing, come join us and be a part of this movement, let's make this app. It wasn't like that. What binds us is this crisis. It is the need to confront a common enemy. It is the motivation to make an impact. And above all, it is a dominant set of values and beliefs that to gain utility, which here, by the way, we mean using a set of data to solve global health problem, it should not come at the cost of our privacy. And that is what SafePaths stands for. While privacy is important, transparency is equally important to us to give reassurance to everyone in these very uncertain times. And that's what, again, SafePaths stands for. We want to have transparent conversations with our community. And this is the key objective of this webinar. This webinar is not about what SafePaths is doing. It is about what it is doing for you. We want to talk about the good and the bad, the pros and the cons. We want to take this opportunity to raise your concerns and address them. We want you to challenge our assumptions and ask us questions. And so we can deliver something that is for universal good. We also want to talk about solutions you seek and solutions you can provide, like COVID Alliance you just saw, and build an ecosystem to restart economy, rebuild trust, get us on our way back to pandemic. So on that note, we would now like to take some questions from you all and challenge us on all the things that we're doing here and involve you more with our work. So for the first one, maybe we can try and get our Grant online, if it's possible, Brian, to ask his questions himself. Would that be a possibility?
Yes, so our Grant, if you want to try and talk now, feel free and ask your question.
Or maybe we can come to our Grant in a while till the time he kind of comes and takes his space. I will move to the next question, which is from Adam, who asks us that given that GAEN says they will only support one app per country, how can big employers find a solution in the countries where there is a national competing app? Ramesh.
Yeah, that's a great question. And this is something that we have thought about for a very long time. And also we have been in touch with our friends at Apple for a very long time. And so we have some great solutions. So if you are interested in discussion, please contact us and we can walk you through our workflow of how these solutions will be deployed. And indeed, you will need a partner like SafePaths to deploy it because, of course, you won't have access to all these APIs otherwise. So we have a fantastic solution that is interoperable, that can work for citizens, public health, which means particular countries and states, as well as big employers. So this is really the advantage you have working with SafePaths.
Thank you. And our next question comes from Rejoyce, who says, do you have a plan for methodology for opening schools and universities?
Yeah, this is actually a fantastic question because as you know, the first thing that gets done in epidemics is to shut down schools and colleges. I think if others can go on mute, please. The first thing they do is shut down schools and colleges because that has been shown to be the best way to prevent the chain of infections. And so reopening schools and colleges is actually the most difficult problem when we go back to work. And so what SafePaths has been doing is actually participating on a few pilots, few trials on certain campuses already. Unfortunately, we cannot disclose them because they are under NDAs, but we have learned a lot through those pilots with lots of hardware, lots of software, with lots of participants, and so on. And in the coming weeks, we'll share with you if our partners give us the permission to talk about them. But we already have some fantastic pilots going on, some really great early results in hospitals, in schools, and so on.
One of the next question that comes is from Thomas, who asks that under Google Apple rule, is health authority allowed to combine data from two separate phone apps while preserving privacy? In doing so, we would have the context by matching the timestamp from both app logs.
Yeah, so just to be sure, let me decompose your question. So the question is, let's say you are in Oklahoma and you're in Texas, and both of them have their own apps. What happens when somebody from Oklahoma goes to Texas and the other way around? And what SafePaths is building, we haven't announced it yet, is a solution that will work across these two particular apps. And so we're providing SDK and APIs, and you'll hear about them in the future, that actually create true interoperability, which means that the key servers don't have to be disclosed between these two entities. At the same time, an individual who's traveling across the state can still benefit. And please stay in touch with SafePaths, because we'll be making all those announcements of the API, the technology, the privatization layer, the practical scalability of it, and so on. So you'll see those documents coming out in the next few days.
Great, thank you. So maybe I'll ask the question from our grant myself. I don't think he's available to talk. So would it be possible to hack on Bluetooth and GPS without using the new exposure notification API, GAEN? Or is this also expected to be refused by App Store policies?
Yeah, so again, I don't speak on behalf of Google and Apple, and this is not kind of a customer support session for Google and Apple. So I don't want to interpret what the documents are saying and what are private conversations with these companies are going on, but I'll give you my interpretation, but I'm not a lawyer for Google or Apple, which is that what they have said is, if you have your own app that does not use the exposure notification APIs, you can do whatever you want. But if you use the exposure notification APIs, then the only thing you can use is the exposure notification API. You cannot use anything else. So those two are different worlds, and our expectation that those two worlds will merge over time, because these companies have good intentions and they really want to solve the public health problem. But I think it makes perfect sense that the very first thing that comes out is in a sandbox. It's sandboxed in the way the Google Apple APIs work. Nevertheless, SafePaths, as an entity that really wants to solve the public health problem and getting everybody back to work, we will support all the permutations and combinations of this, including an app, including SDKs, including code base that uses just the Bluetooth Google Apple APIs, a full-fledged open source app to achieve that for you. And you'll have that available in the next few days. And we'll have these two parallel versions, and they'll merge at some point. So if you're trying to build your open source version based on Google Apple APIs, don't waste your time, because you'll have that solution from us, open source and tried and tested in the next few days.
Great, thanks. So we have Kanzu here, and he says he's a PhD from Stanford, and he's saying that we are building models that look at how policymakers can optimize the use of contact tracing, because there is a high usage need, 70% of the population, to be effective as some of the other measures. Can you touch on how policymakers are thinking about using the apps to optimize its effectiveness?
Yes, so I think we have a big data science team that continues to analyze this, and there are other data scientists who have looked at it. And I think the broad numbers I have heard are, you need to capture about 60% of contacts of 60% of infected people in less than 48 hours to make a meaningful impact on reducing the R0. So I think that's the general opinion from data scientists, and so that seems to be roughly along the lines of what you're saying. We think a GPS-based solution does not require such a high penetration. You start get benefits even with first 10 or 20% penetration, because you can use other mediums like news channels, news reports, Twitter and so on, to disseminate information of hotspots. Because right now, as techies, we might think there's this awesome magical solution where suddenly you get an exposure notification, boom. That's not how most of the time things work. The way things work is you have somebody who is an essential worker who got infected, but they don't understand their symptoms. They go home, they end up infecting their family members, or there's an individual who had an underlying immunocompromised condition who did not take the symptoms seriously and ended up being in hospital and so on. So from a public health point of view, it's not about the exposure notification. It's not about the contact tracing. It's about people showing up in hospital, not realizing it's too late for their own health condition or overwhelming the health facility. We are not worried about people getting exposed. We are not worried about people getting contacted. We as a society are worried about, can public health cope with the situation where they don't have a downstream solution for it.
Great, thank you. Another question is from Gary, and he asks that, can't users record and keep their own location to themselves without sharing them with the other contacts, and download the contacts of interest identified by Bluetooth Your location is only stored locally and cross-referenced to your copy of the contact record? I think it's a very important question for us to.
Yeah. So let me also decompose that problem. I think you're asking 2 or 3 questions. I think what you're expecting, Gary, is that we carry 2 apps. One app that's provided by Apple and Google that just gives you exposure notification, which means that the only thing it will tell you is that on Tuesday you're exposed, not the time, not the place. And then you run another app that actually keeps track of your GPS and time. So you can say, hey, I got notification on Tuesday, and let me say where I was on Tuesday. The problem is the only information you have from the Google Apple exposure notification is the day of the encounter, not the time or the location. So in that case, it doesn't work in parallel. So one solution for that would be at some point, these 2 methods will merge. And as we say at SafePaths, we continue to say the most private, the most secure platform is recording your own GPS location. That is the most private way to solve this problem. And public health entities say the same thing as well. For the infected person, that's true for the healthy person. For the infected person, there's some leakage in their identity because let's say, Gary, you did nothing in the whole day, but you met one friend and you got an exposure notification that on Tuesday you were exposed. You know exactly who that person is, which is your friend. So in that sense, the identity of the infected person is leaked to you, right? Not to the rest of the world, but it is leaked to you, right? In reality, what ends up happening is the infected person has to interface with public health anyway. So they're governed by the HIPAA rules or the health privacy rules and so on. So the fact that the infected person who had to do a test and interface with public health person anyway, their identity is known to the public health anyway, right? What matters is whether the identity of the exposed person, the healthy person, is revealed or not. So just to separate that out, the 2 entities we care about. For the healthy person or the exposed person, nobody other than themselves should know, and that should be the privacy principle. For the infected person, clearly there is a leakage in their identity because they have to interface with the public health person. And so that's the philosophy of SafePaths, which is awesome, perfect privacy for the healthy person and some leakage in the privacy of the infected person. When you come to Bluetooth, it's the same exact situation because Bluetooth only solution, which is infected person still has to interface with public health. So it's not like cryptocurrency or something else where none of the participants are ever known to anybody else. But in public health scenario, the infected person does have to interface interface with public health. So their identity is known to the government and known to many people. But again, the healthy person should continue to maintain their privacy. So in our opinion at SafePaths, I think both these solutions can coexist, but we perfectly understand that in the first version from Apple and Google, they will not allow us for these solutions to coexist. But our expectation is that over time, this will change. And as public health and governments and individuals start demanding more context, these solutions will merge. And SafePaths, that's why it's ahead of the game in that sense, because they're building out all these solutions and all of them will be available as Lego pieces. So if you're a nation or if you're a big business, then you would take pieces of our code and build your own solution or work with us so that if it's a large enough geography, we can help you deploy the solutions from SafePaths, in addition to the dashboards, and that we can talk separately.
Great. So we have one very important and interesting question from Sylvain, who says that as the societies open up, there are certain gaps. One is the tests. The second one is that the virus lifetime on the surfaces. So how does a smartphone-based contact tracing help this, and what is possible?
Yeah, so Sylvia, I'll be the first person to say that technology is not going to solve this problem. Let me say that one more time. Technology is not going to solve the problem. What's going to solve the problem is technology with public health infrastructure. And so every day when we wake up as technologists, the first thing we should think about is how are we going to interface and amplify and simplify the work of public health. And that includes manual contact tracers, that includes people who are ramping up the tests and so on. And so that's, we have to be very humble and have that humility to understand that. To your specific question about fomites in infections from surfaces, I think the McKinsey report that just came out, and that graciously talks a lot about SafePaths. The McKinsey report on their homepage today talks about the right solutions for contact tracing. And what they talk about SafePaths is that because it combines multiple modalities, so GPS can capture fomites because as long as the same place, even with a 10-minute or 1-hour delay, surface infections can be captured. If you have proximity, then maybe Bluetooth-based solution works really well. On the other hand, if you have a hotspot, if there was a wedding or there was a conference, there's an infected person that ended up impacting 100 people, it's important to capture and make all the 100 people aware of a potential hotspot there, as opposed to saying only the 5 people who exchange Bluetooth tokens should be the one to inform. As you know, even in the US, less than 50% of people over 65 have a smartphone. So if there was a person over 65 at that wedding, it's a very good chance they don't have a smartphone, and they need to be informed of what should be done and that they should be careful about it.
Great, thank you. On that, maybe I have a question for you guys, and especially for Ryan, that what role would Google and Apple infrastructure play in Ryan's ecosystem? And does it go beyond contact tracing and what they offer in his ecosystem? If Ryan would like to talk about it.
Sure. I think that's a great question. I think fundamentally we have to really figure out how Google and Apple's solution interfaces with the public health departments, because I think that's sort of the main broker. I think that goes to Ramesh's point as well. It's technology not in a vacuum. And so we're trying to build a framework and an open standard around the provisioning of services for people by the public health department. But that sort of will be integrated into the tools that are being created for them. And so then I think that's what I think is the next step. We're trying to first get the standard in place, trying to figure out, we don't want to say that we're going to create the tool and the standard if that means that we're fracturing a network of tools. Too many tools doesn't help everyone. And so trying to figure out, is our standard going to be deeply embedded into someone else's tool that's the solution for the public health department? Are we going to create a separate tool that has nice API integrations with that other tool, or all what we're sort of evaluating right now? All of those would still be triggered off of the exposure notifications. So I think something that was key to Ramesh's point is that individuals who have tested positive and now need access to social services, well, those people are going to be known to the public health department, right? The public health department has it in the legal framework where they get the information of the people who have tested positive, because they actually need to sort of provide additional support. There are additional rules and capabilities around that. And so I think whether that's mandatory quarantines for individuals, I think we don't want this to be a sort of a stick approach. We think the carrot is a lot more powerful. And so if you empower someone to not leave their house because you give them access to meal services, if you empower someone to not have to worry about getting their family sick because you deal with displacement and getting them out of their house so that they can quarantine effectively somewhere else, all of those things I think will really make people realize that it's not an adversarial liberty restriction with the government, but it's a collaboration. But that's still, you can see why that also has to come down with a verification of your situation, and potentially that's not just your COVID status, but it's, are you immunocompromised? Do you have family support structures? Are there other people living in your house? All of these things are essential because we want to provide, services to people who really need them. And if on the other side, if people game that system and just use it to get free hotel rooms and free food and things of that nature, that's not helpful to the solution. It undermines the credibility. And it misallocates resources as well. So I think sort of that is all going to be integrated with the public health department. And I think they will have sort of the control over this. We're trying to figure out what that looks like for them now.
Great, thank you, Ryan. I'll take maybe the last question for now, which is from Rejoyce again, which she asks us that the main strategy for reopening our economy is test, trace, and quarantine. And SafePaths is talking about trace so far. Is there any way to use the SafePaths app for testing and quarantining? And I think that's a great opportunity to talk about our ecosystem here. Either of you can talk about this. Yeah,
I think that's a very good question. I'm going to take a slightly different position, which is that I know test, trace, and isolate is, the approach that's, very well promoted and encouraged. We personally think that testing alone, testing is not going to scale at the rate at which we think. even vaccination is going to scale to 7 billion people in the next 1 year, even after the vaccine comes out. So the digital solutions are actually going to be around for are going to be deployed at a much wider scale than testing or vaccination. And so that's why it's very important to work with public health to figure out how can we minimize the impact on the population in absence of widespread testing. Because even if you test people every 2 weeks, which is what many rich employers can afford to do right now, again, testing every 2 weeks is just not sufficient, because you could get infected the day after your test, and you still have 13 days to cause significant damage in your work environment. So what does testing mean? Are you going to test every day, every hour? And tests are only 60, 70, 80% accurate. So there's a lot of challenges around testing. So we have to actually rely on symptoms and not just full-fledged COVID-19 tests. So we think at those 3 layers, symptom checking, fever testing, and COVID-19 testing, but think about the digital solution at all 3 levels, and the tracing and isolation can scale corresponding to that. Clearly, with symptom testing, you will have a much larger kind of a catchment area. You might end up creating more panic, but as long as you let people know that this is a fever tracing and not COVID-19 tracing, individuals can take a response. COVID-19, on the other hand, we hope is a very tiny fraction. Maybe at a given moment, in a 2-week window, maybe 0.1% of the population is COVID-19 and symptomatic. Hopefully we're in that place. So in that sense, the impacted people are actually very small, but this challenge is going to be with us for next year, maybe 2 years. My colleague Kevin as well says it could be 5 years before we have this genie kind of back in the bottle. Maybe that's not a good paradigm here, because this is really a monster, not a genie. And so given that, at SafePaths, we believe that the tracing is actually the most important component, even more important than scaling testing.
Great, Ramesh. I was saying that it was the last question, but I'm just tempted to ask the next one as well, because it goes so well into what you're talking right now, which is from Sylvia, that she says that, what about biotech trackers? Too invasive, too expensive? Can they be of use as well somehow, somewhere?
Yeah, so I think you're talking about, how are the strains of the virus changing, and how would they impact? Or maybe you're talking about other biotech diagnostic methodologies. So I think, we think that those two are also very data-driven problems. And whether you're tracing individuals over time, or you're tracing, the strain variations over time, it's the same problem for us. So we would love to collaborate in that space. I think it's still too early. It's not as widespread. But as time goes on, whether it's serology testing, which is antibody testing, or strain testing and so on, all of them will play a very critical role as goes on. I mean, if you know that the strain is very different from, say, New York to Florida, it's very different between 2 different states, say New York state and the Florida state, then we can assume they're being contained. But if they start as soon as the strains start migrating from one state to another state, then we know it's happening because of community transmission as well. So those are very important signal for tracing, but I think it's still very early days for us to really to say something meaningful about it.
Thank you, Ramesh. Thank you, Ramesh, and thank you, Ryan, for all your insights here and the questions. And thank you to our audience for asking these such insightful questions. We could not take them all, but you can leave your questions and your email addresses. We'll try to get back to you with all the answers. With that note, I will leave this thing to now Rachel to take it forward with Sienna, maybe.
Hello, Sienna is here with our field report. Sienna, do you have a moment to give us an update?
Yep, just a brief moment. We're actually jumping over our team to talk to a major city in the US about implementation. But we're really excited. Every week, as you heard Ryan and Ramesh describe, is the conversation evolves, where we started as an implementation team 8 weeks ago. It's hard to believe at this point, but really we were focused on these 2 words that now are part of our day-to-day vocabulary, which is contact tracing. Speaking to cities, counties, states, countries about contact tracing tools while we were all learning as we go along. That conversation has evolved as each week we get more data, more information, new reports like the McKinsey report that Ramesh alluded to earlier in the call. And those have really informed the conversations that we have with not only public health officials, but we are noting that the meetings that we have really expanded to include private sector task forces, elected officials, officials focused on economic development. And so including the meeting that we have presently, it will include a lot of partners that a month ago weren't at the table. I loved the question about higher ed, is we do have a team that's in collaboration with a group of undergraduates that will be really focused on higher ed. And you'll see some news on that over the next few weeks as we're in this very odd gap between final exams and commencement exercises at campuses really around the world. And we want to take advantage of that time period in order to really empower the voice of students. And so anyone interested in that, we really invite you to get involved because that will be a key piece of implementations going forward. Our other conversations really have also focused on questions about the Apple Google announcements. And so we have really been privileged, I think, to be able to serve as a resource for those that need the information quite simply translated. People that weren't, familiar with the application development process, that want to work with a trusted resource collaboration effort like this one to help them maneuver through uncharted territories. And so again, that continues to be the thread of our conversations. We never know what the future holds. So next week, I'm sure that will continue to evolve. But we're really excited to see pilots moving forward in the training phase, implementation phase, adoption phase, so we can start to really help as many people as possible throughout the world. Thank you, Rachel.
Thank you, Sienna. Now, I know I've said a few times already, but my favorite thing here is just the amazing and talented people I get to work with. So before we sign off, I know you've gotten a chance to hear from several people, but there are quite a few behind the scenes who have made today come together as well. And so I just want to introduce you to them very quickly. Our team behind the scenes, could you say a quick hello?
Hi.
Hey everybody, I'm Brian. I'm helping produce the webinar today.
Hi all, I'm Kristen and I'm the current communications lead. I'm very excited to, have you all on the call. Thank you so much.
Hi all, my name is Madi Fada. So happy to see everyone here from all over the world. As everyone has mentioned in the webinar so far, please don't hesitate to join our Slack community or fill out the form if you'd like to contribute. We're always looking for great people to join us in this movement and push this cause forward. I've shared some links in the chat and I'll be posting them again, so please don't hesitate to join us. Thank you so much.
And Rob is on here too. I'm not sure if he can say hello right now. But we want to thank you all for joining us today. We really appreciate you all being here with us. Please connect with us either on our website, covidsafepaths.org, or on your favorite social media. And we're looking forward to hopefully seeing you next week. Take care, everybody.
Thank you.